Then when you get onto the posterior aspect, of course you're talking about the scapula, the spinous process. The set joints, obviously their set joints are going to be a little too deep to really ever get into palpating. Set joints are way deep in here, you're not necessarily going to palpate that, but you're going to palpate the transverse process. And you can identify if somebody has tenderness away from the midline, or if it's just straight in the midline, if they have tenderness over the spinous process. In the special test, we'll talk about spinal percussion. And then, obviously, again, I'm not sure why that's in here. You can't palpate the costovertebral junction. I mean, that's deep inside of here. Right? So, cross that out. The idea is basically you're just palpating on here, and in a general sense, when we talk about palpation, you're looking for tenderness, deformity, things like that, muscle spasm. So when you're palpating on the back, you're looking for those types of things. Whereas their tenderness, muscle spasm, deformity, things like that.
For costovertebral junction, I can't feel
I guess it would be more like the costotransverse would be a better term for that. Costovertebral is way deep down in here. Okay? Costotransverse should be, we'll change that to costotransverse. And like I mentioned, well, you know what that T/S means? Thoracic spine. Right? So a lot of the nerve roots aren't really affected that much unless you're talking about something like shingles, and that's more of a skin condition. All right, so at this point we'll take a break if anybody needs to take the quiz. All right, so what we'll do is I'll talk about these tests. Probably we'll talk about all of them, and then we can go ahead and get out the tables this time because there's a few things that we can do with the cervical. So we'll review all the cervical and thoracic tests today. Should have enough time. All right, spinal percussion. Basically what you're doing is you're tapping on the spinous process. You can do that a couple different ways. You can tap with your fingers. You can hold the finger down, tap one finger on top of another, or you can use a reflex hammer, directly or indirectly. You're going to do two things. You're going to tap right on the actual spinous process, and then you're going to tap on the paraspinal muscles as well. So this basically is going to be an inert tissue type of test. We're talking about nerves. Although when you tap on the bone part, you're doing inert tissue. When you tap on here, you could be doing both. You're starting to get into the contractile tissues as well. A lot of times it's done either standing, you could do it prone, and then you have the hand bend forward like that to try to bring out the spinous process a little bit more. And then if it's pain on the spinous process, that's going to indicate more likely to be a joint problem or an inert tissue issue. It could be a ligament problem, it could even be a disc. And then if it's soft tissue pain along the side, then that's going to be more likely to indicate soft tissue injury. It's kind of just a general scanning type of exam or test. If for some reason, if you tap in on the spinous process and they have some kind of severe pain that lasts for a half hour, longer periods of time, there might be something more ominous going on there. There might be some type of a tumor or something that's affecting the bone. You're not going to see that too commonly. And then costal compression and percussion. Again, what I mentioned before, if you're suspecting some type of a rib injury. So first we talked about spinous percussion. Now we're talking about costal. So again, you can do where you can put one finger on top of the other and tap like this. You can use a reflex hammer like that. So that's the percussion aspect of it. Then you have the compression, where you can do it in this way where you're doing A to P. Then you can do it straight lateral. under the arms like this, pressing like that. Then you can go at an angle like this. Okay? If there's issues, if it's a female patient, especially if you're a male examiner, you can do something like this. We can have the patient put their fist over the front of the chest like that. So they'll put their fist on here like that. You use your hand like that. We can do that over other, sensitive areas of the thoracic cage on the front. So again, you may feel, they may have the pain directly over the area where you're compressing, or it may be off to the side somewhere. If you're pressing like this, and you feel, the patient feels the symptoms over here, that can indicate, a fracture, or costosternal separation, costochondral, all those types of things. So it can be any one of those, all those different fractures or separations that we talked about. And then here's the Adams position. So again, if they bend forward and the curve remains like that, basically what you're looking for is the ribs. Okay? And you're looking for that. Now, is that a structural or a functional? Structural. Right. So then here, this is the position you're going to be in. You're going to be looking as they bend forward like that. So if they're forward like that, you may change your body position where, depending on what type of the part of the spine that you're looking at, you may want to kind of, if they're bent over, you may be looking down low to see the lumbar. You may look over up into the thoracic. And then the way that I'll write that down, I'm going to, put it in the notes, and you can do whatever you may want, but I'll go with something like this where, and then, so it's telling me that it's higher on the right side, and then I'll put either, or tell me if it's in the thoracic or the lumbar. Because a lot of times, when you do these tests, we're learning how to do the special tests in here, but you also are going to be writing these things down. Remember, for as far as medical records purposes, insurance billing and all that stuff, if you didn't write it down, you didn't do it. Okay? So you want to have your own ways of writing these things down. Eventually, when you get in practice, you just have a standard form that has some of this, all the tests maybe listed already. You just write in positive or negative, and then what the findings are. So then on the diagnosis, I need to add that on the PowerPoint, but in your notes it says diagnosis of scoliosis, and you're differentiating between structural and functional. And then passive scapular approximation, just like it sounds, you're approximating the scapula. The patient's going to be prone. You're basically pulling back on the shoulders. So you're lifting the shoulders up and back when they're prone. And then you're looking for pain in the upper scapular area. It can be, the diagnosis can be a T1 or T2 nerve root problem, or you can have dysfunctions of the scapulothoracic joint. I mean, it's not a true joint, and we'll talk a lot more about it in the shoulder, but this articulation between the scapula and the rib cage is more of a functional joint because it's basically muscle against muscle. There's no cartilage. It's a functional joint. So sometimes people will have problems underneath that scapular thoracic area. They'll have maybe like crepitus or popping, things like that. So if you're pulling back and they have problems in here, it could be that, or it could be, like I said, a T1, T2 nerve root problem.